Have you ever been tired, exhausted, and frustrated with the direction that your health is taking? When you try to get help from your doctor, your labs come back normal. Today, what we're going to do is we're going to take a deeper dive into what that actually means and a different way to start approaching your health from a wellness model, a proactive model. Instead of just simply focusing on what to call your symptoms, we're going to be focusing on what's causing your symptoms. You see, this was happening to a client of mine named Sarah. She had been to multiple doctors, always handed a prescription with no real answers as to what was really going on. She was struggling with exhaustion, weight gain, gut imbalances with irritable bowel syndrome, feeling bloated and painful and indigestion and just always exhausted and having massive brain fog. This is what she was stuck in, and she was frustrated with the lack of answers that she was getting from the medical doctor. And that's when she really started seeking different answers and came upon us, which is a functional medicine clinic that fixes the root cause of the problem. And as it turned out, this is exactly what Sarah was looking for. You see, Sarah had a mother and a father who had also had very similar challenges, and she had seen the direction that their health had taken. And while she loved them very dearly, she did not want to take that same approach. She didn't want to end up like mom and dad. And that's why in her mid-40s, she decided, I'm going to start taking action now before I end up in my mid and later 60s, before things really continue going down this same road. Now, there's never really a time in your life where it truly is too late for you to start. I mean, there are circumstances very far and few between, but she didn't want to continue to suffer for the next 20 years until she had had enough. She had had enough right now, and that's why she decided to reach out to us. And so what is functional medicine? Functional medicine is the science and the way of medicine of fixing the root cause of the problem. You see, what happens in most conventional medicines, in most hospitals and clinics, is they focus on masking the symptom with a medication. Now, I'm not here to take anybody off of their medications or even saying that medications have no use. Yes, they do, obviously. If you need a medication to maintain a quality of life, take it. But if there's something that we can do to enhance your quality of life and you have to stay taking the medication, isn't that the best of both worlds? I mean, the medication is supposed to mask the symptoms, and in many cases, the clients that I speak to, the medications aren't even doing that. So it's about how do we get your body to function optimally? How do we regain your energy? How do we actually allow your body to feel fulfilled and optimized so that way then you can interact with the kids, with the grandkids, lose weight, feel confident in your own skin. This is what true health and wellness looks like. It's not just simply in this vicious cycle of always feeling like you're trying to survive method. You see, when you're thinking about traditional medicine or conventional medicine, most of their therapies are medications. And what medications will do is they just simply mask the symptom of what's actually going on. So for example, if we have someone here who's feeling sad, they start taking a medication for the depression or anxiety or feeling sad, and then they're going to start wearing this mask. It's going to sometimes help them feel better. It's going to help them feel better in the moment. But then again, what happens is there's often side effects as a result. There's often side effects as a result of the medication. So let's talk about conventional medicine, or 99.9% of the healthcare that's used in this country. This is the healthcare that is going to be covered by insurance. And what insurance is going to cover is medications. And like I said, I'm not here to take you off your medications or saying that you shouldn't do this. I'm talking to people who are looking for a different result other than just the medications. Whether you're on medications or not, doesn't matter. If you want a healthier future that is natural, this applies to you. So for example, if you're feeling sad, feeling depressed, you're feeling anxious, you're going to start taking a medication to take care of that symptom. And what comes along with that is side effects. And this is where conventional medicine and functional medicine change completely, because while conventional medicine focuses only on the medications to actually fix the problem, they don't ask the big question as to why are you feeling this way in the first place. So to continue the example, the traditional medical model uses medications or surgeries to deal with the reasons why you're feeling sad. Now, a completely different approach is to actually ask the question as to why are you feeling sad in the first place? Because once we can actually fix the root cause of the reason why you're not feeling optimized, why your brain is feeling sad, maybe it's coming from your gut, maybe it's coming from electrolyte imbalance, Maybe it's coming from a vitamin deficiency, but we need to figure out the reason why. And this is where the proper lab testing needs to come in. Now, you might be saying, well, doctor, I've had all my labs taken. They come back normal. I still feel this way. This just must be the way that it is. Wrong. With typical labs, what is taken is just a very, very small amount of laboratory analysis, because health insurance is only going to pay for labs that they can prescribe drugs for, and that is it. Not only that, but you're also being compared to 90% of Americans. Now, you can automatically think, are 90% of my friends, my family members, 90% of the people that I know, are they optimally healthy or are they sick? Most people are going to say, most of the people that I know, 90% of the people I know are sick. And so you're going to get compared to all of the sick people out there. So that's really the question that you want to ask yourself is, do I want to compare myself to all the sick people in America? That your answer should be a resounding no, which is why we need to start looking at preventative labs. There's something called functional medicine lab values. So this is preventative medicine. So in terms of preventative medicine, what we can do is we can actually figure out the reason why you're feeling sad in the first place. And like I said, is it a thyroid problem? Is it a gut problem? Is it a brain problem? Is it an immune system problem? Just to name a few. There's many different possibilities as to why you might be feeling depressed, whereas conventional medicine only focuses on the medication. Functional medicine will go ahead and look and try to decipher what is actually causing this to happen in the first place and fix it so that it doesn't become worse. Because the sad matter of fact is that if you don't deal with the root cause of the problem and actually fix what's going on, then one medication turns into two turns into three medications, and the snowball continues because we're not actually fixing where the problem is coming from in the first place. And that is a huge difference between functional medicine and conventional medicine, whereas one is looking just to simply slap a label on you so that way they can shove you out the door and hand you a prescription. The other one looks at you as an individual and seeing what is not working inside of your body that should. The next major difference between traditional medicine and functional medicine is in traditional medicine, you look at the problem, the part of your body that's not working, and that is it. For example, if you have inflammation and arthritis in your knee and you only look at the knee, you go into the doctor's office and say, hey, I have problems with my knee. I got a lot of pain and inflammation. It's sore and stiff when I stand up after sitting for a long period of time. It takes me a couple steps to get going. I feel very stiff and this hurts. This sucks. What the heck is going on? They're going to give you some cream. They're going to give you some anti-inflammatories for your knee, some steroids. That's how they're going to fix the inflammation. Whereas in functional medicine, we're going to try to ask, is the inflammation right in your knee or is it actually being caused by something else that's going on in your body? Let's look at your body as a whole, because I'm guessing the inflammation in your knee didn't show up just because it's Tuesday, but it's there for a reason. There's a reason why your body is giving you these signals. Let's figure out what it is. That way you don't have to put on a cream every single day. And the third one, whereas in traditional medicine, they simply look at your symptoms, they look at you as a number and send you out the door, feed as many people through as possible. In functional medicine, we stop, we slow down, we listen to your story, we look at your symptoms, we look at your case as a whole, and no two people are alike. Therefore, why should your treatment protocol? It doesn't make any sense. So if we try to put you through the exact same system that everybody else is going through, it's probably not going to work. And that's why so many times people feel frustrated with trying to get their health and wellness back. And it's because they're left alone, they're not being shown clearly what to do, and that's where we step in. We can show you exactly what steps to take, what steps not to take, so you can feel confident in moving forward. To go back to my client Sarah's example, she was frustrated. Her labs were coming back normal. The doctors really didn't have any clear answers except for more steroid medications, which she had horrible side effects from. She was tired all the time when she was on it. She was gaining weight rapidly. She gained 20 pounds in the first 30 days. That was not an answer that she wanted. And so what we did is we first took very detailed labs, what I call nose to toes. We looked at everything that's going on inside of her body. So that way there was no more guessing games. We stopped, we slowed down, We looked at her body as an individual and as a whole. We looked at everything: gut, thyroid, immune system, vitamins, white blood cells, cholesterol, everything inside of her body. So that way we knew exactly what to target and what to ignore. And that gave her a tremendous amount of confidence on what to focus on and what not to focus on. And then she was able to actually just simply put her head down and go, and her body healed. So within the first 60 days, she no longer had the gut system symptoms that she was having. She had way more energy, and she was starting to lose some of that weight that steroid medication gave her. At that point, it would have been 90 days prior. So she was losing weight slowly and sustainably, so that way she wasn't going to simply go on the yo-yo. But we did this all through actually fixing the root cause of the problem. So I have a friend that I've been helping. His name is John, for many, many years with his health and doing it naturally. And, you know, I've been giving him tips on what he can start change for his health naturally. And lo and behold, I give him some tips and he goes away and he actually takes action. To his credit, he actually does it and he follows through, and he's been consistent. So I've enjoyed coaching him in this way. He says, I don't know why when I do what you ask me to, it works. It's like you're the voodoo doctor. I'm nobody's voodoo doctor. It's just simply a clear understanding on how the body functions at a cellular level. So that way we know exactly what your body needs, what it doesn't need, and really just cut through all of the lies and misconceptions that media, big food, big pharma, and conventional medicine has spent the last 70 years putting into our brains. We simply need a simple, well-educated, well-researched knowledge on how the body actually functions and how to apply it to that person specifically. So if you're looking to fix the root cause of the problem with your health and wellness, my name is Dr. Forrest Sauer. You can click on the link below, schedule your discovery call, and see exactly what your journey would look like specifically for your health. If not, click on the next video, and I look forward to chatting with you soon.